actually diagnoses tongue ties, and why does it feel like no one is ever on the same page? We are continuing our tongue tie series. Today, we are going to set the record straight on what it means when your doctor diagnoses or doesn't diagnose a tongue tie, and where you should turn if you think tongue tie is part of your breastfeeding struggle. Hey, Mama Bear, welcome to the Breastfeeding with Confidence podcast. Do you dream of bonding with your baby through exclusive breastfeeding, but worry about breastfeeding pain or low milk supply? Maybe you're struggling with breastfeeding and no one seems to have any answers. I'm Jaimie, doula, international board certified lactation consultant, and mom of 5, and I have been where you are. After working through painful latches, milk supply worries, and postpartum depression, and supporting countless mothers through their breastfeeding journeys for over 8 years, I'm here to tell you breastfeeding doesn't have to be perfect to be positive. Each week, I'll share breastfeeding tips to help you prevent and overcome unexpected breastfeeding challenges so you can actually enjoy bonding with your baby. If you are ready to shut out the toxic whispers of the world, embrace your God-given intuition, and release your inner fierce mama bear, grab some coffee or your favorite herbal tea, and let's dive in. Today, we are going to talk about tongue ties. We're going to talk about diagnosing tongue ties specifically. A lot of people wonder, how do you diagnose a tongue tie? Who diagnoses a tongue tie? And why does it seem that one person said my baby doesn't have a tongue tie and somebody else does say they have a tongue tie? Who do I listen to? Where do I turn? Where do I get answers? Today, we are going to specifically talk about what an IBCLC can and cannot do when it comes to diagnosing tongue ties, the common gaps in your pediatrician's assessment, why most providers don't actually look at function, and how to advocate for a full functional evaluation. But before we get started, I wanted to take a few seconds to invite you to my free Secrets to a First Latch Without Pain live workshop. I am so excited for this. On April 5th, I am doing this workshop live for the first time this year. It's going to be so much fun, y'all. I can't wait to see you. Instead of you just listening to me, we'll get to see each other and we'll get to chat. We'll be busting breastfeeding myths. We'll be creating breastfeeding success game plans. And I'll teach you my go-to latch technique that hundreds of mothers have called a game changer in their breastfeeding journey. Plus, since we'll be live, we're going to have a few fun and exciting door prizes to give away, so I want to see you there. If you are pregnant and want to set yourself up for breastfeeding success from the start, or if you're struggling with breastfeeding and just want to kind of rewind, get back to the basics, and get a fresh start, visit www.littlebearlactation.com/secrets. littlebearlactation.com/secrets. If you can't remember that, the link will be in the show notes. I want you to come claim your free seat. Y'all, this is a free event. It's a free event. Be there. Let's dive in. All right, let's talk about the IBCLC's role in tongue tie assessment. It is really important to clarify that lactation consultants cannot legally diagnose. However, we are often the first to recognize functional breastfeeding issues that are related to oral restrictions. IBCLCs are able to assess how the tongue is moving, how the baby is latching, and the impact on breastfeeding, which a lot of other providers don't necessarily look at. When we are doing a functional latch within the context of breastfeeding, we look at what mom is experiencing physically, emotionally, what her intuition says. We look at her milk supply. We watch how the baby feeds. We address, basics first, but then we watch how the baby feeds. We consider their feeding behaviors, what's normal, what's not, what they're doing. And then we do a functional evaluation where we take time, and we visually and functionally assess how your baby's tongue is moving within the context of breastfeeding. So a lot of people will say, oh, well, she can stick her tongue out. We're not looking to see if your baby can just stick her tongue out. We're looking to see if your baby can stick her tongue out, maintain that extension, and then elevate the tongue, grip the breast, and stimulate milk removal and maintain extension the entire time. We're looking at so many different parts to the latch, so many different pieces of information, and we are doing visual assessments as well. So, what happens when your lactation consultant says, "I think your baby has a tongue tie"? When I'm working with my clients, it's really important to me that I tell them I am not diagnosing your baby with a tongue tie. However, the things that we are seeing are checking a lot of the boxes that can signify your baby could have a tongue tie. So, what we're going to do first is not go get a release. First, we're going to implement certain activities. We're going to implement certain changes. And we're going to monitor this for a minute and see how feeding changes, if it gets better, if it gets worse, if something, just see if something changes. We're also often going to look at addressing physical tension to make sure we rule out other causes of tension because tongue ties are not the only causes of tension that can impact feeding. So we want to address that tension. We want to take a very holistic and non-invasive approach first. But we want to keep that idea of a possible tongue tie in our back pocket so that we can address it when it's necessary swiftly and easily. So then, if we kind of go through the steps and we realize, maybe this baby does have a tongue tie, I think we need to get a further assessment here. As an IBCLC, what I do is I communicate with the baby's pediatrician and with a release provider who has a good reputation. And I send them information that says, like, look, this is what I'm seeing, and how feeding is impacted, XYZ. These are the symptoms I'm seeing. This is the impact. This is what we've tried. This is what worked. This is what didn't work. Can you do an assessment and rule out a possible tongue tie? At that point, it really is up to the provider's experience in how things go from there. So, if we're talking about pediatricians, there do tend to be some limitations with pediatricians diagnosing tongue tie because the truth is, most pediatricians just don't receive in depth training in oral function or breastfeeding unless they specifically and intentionally seek it out. They typically only use a visual approach. So they kind of say things like, well, if it's not a severe tongue tie, it's fine. If it's not an obvious tongue tie, it's fine. Or one of the worst ones that I've heard is if baby's gaining weight, then the tie is not a problem. They also tend to sometimes dismiss mom's pain or other feeding issues as sensitivity, being a first time mom, just not making enough milk. They blame things on other things and don't often look at tie. This is especially true when the tie or the functional impairment is not super visually obvious. What I mean by that is if your baby's frenulum is at the very tip of the tongue, most pediatricians will recognize that. But if there's a posterior tongue tie, many pediatricians will not acknowledge or recognize that can have an impact on breastfeeding. So, what do you do if your lactation consultant says, yeah, I think your baby has a tongue tie, but the pediatrician is like, no, ties are a fad. This is not a problem. Your baby doesn't have a tongue tie. Well, what I say is we ask why. Okay, you say a tongue tie is not the problem, but we're having these breastfeeding issues. What do you think is causing these issues? And if they can't give you a cause, like a real cause, and they give you some fluffy answer, like maybe they're just saying, oh, well, the baby's not removing enough milk. Okay, why? Well, because his mouth is just too small. Okay, why? And we'll always get back to the reality that there is a tongue tie. When there is a tongue tie, I'm not saying that all of these issues mean there's a tongue tie, but when there is, if we keep peeling back and asking why, the only logical answer is tongue tie if there is a tongue tie. So if your pediatrician does not think that there's a tongue tie and maybe your lactation consultant said there is, all hope is not lost. There are a lot of release providers out there that will work with you and your lactation consultant, even if your pediatrician is not on the same page, because ultimately the pediatrician is not the authority on your baby. You are. and you can always get a second opinion. However, one of the challenges I have seen a lot is patients often want to go to a provider who takes their insurance, which is absolutely understandable, 110%. Or they want to go to whoever their pediatrician recommends. So sometimes the pediatrician will say, I don't think there's a tongue tie, but if you want to look into it deeper, I'll refer you to ENT and they'll take a look, or something like that. And the problem is not all ENTs are well versed in ties in infants, especially within the context of breastfeeding. And that's not to say that they are bad at their job, it's just to say they don't have a lot of experience with that. So, what I have seen a lot in my practice is one of two things happen when these moms go to these providers who are kind of generalists and they don't specialize in ankyloglossia for infants. Okay. So they go to these providers and they get one of two reactions, and that is a 30-second visual assessment that is no different than the pediatricians. And they say, there's no tie here. I don't know what they told you, but there's no tie. There's nothing here for me to cut. I can't do it. The other thing that I'll often see happen is that in an office where they don't specialize in ties in babies within the context of breastfeeding, the provider will recognize that the tie is there and they'll clip the anterior portion of the tie, but they don't do a full release. So mom and baby go through this release. They're like, oh, yeah, it'll be quick and easy. Let's do it now. They've had no preparation for it. And then they turn around and think that because they got the release, their baby's going to have automatic function. And we know that's not always true, but they don't realize that it was not a full release. So what happens is we end up having trauma. Sometimes this causes more breastfeeding issues. We have to work through that, and then we end up having to release again to get it done right. So it can become a very problematic approach. So we have to be very cautious with who we're going to. This whole snip and go procedure thing without the proper pre and post release care is really important. I have seen so many moms come to me after getting this quick snip and being told there's nothing you have to do. Many times the providers who do these quick snip and go procedures, who just don't do a full release, will also tell mom that there's no aftercare that has to happen, that there's nothing you have to do afterward. Breastfeeding is enough. It makes them lift the tongue. They'll be fine. And they don't give them any post-release care. And that is actually setting them up for failure. This is why a team approach is so critical, because not one provider is fully equipped in and of themselves to, quote, diagnose. IBCLCs are not physicians. We can't legally diagnose. When we work with an IBCLC, a good body worker to release that tension, make sure we're setting our fascia up for success, and rule out any other causes of tension. Plus, we have a release provider who understands function and understands the role of the IBCLC and the body worker. Then we can make sure that we are very confident in the diagnosis of a tongue tie, because we have had multiple eyes on this baby. We are looking at this from multiple perspectives to be sure that this is the problem and that release is the answer. And when we have that team approach, a good release provider who can take into account what the IBCLC and the body worker are sharing with them, and then do this release, obviously they don't just do it because they were told to. They do their own evaluations, but they understand. They understand the context. They understand their limitations. They understand how to work as a team. Then we have successful releases. If you believe that your baby is struggling with a tongue tie and you don't know where to turn next, I can so relate with you. I have been there. So many of the moms that I have worked with have been there, and you are not alone. First, you need to do a full functional feeding assessment with an IBCLC. Unfortunately, not all IBCLCs are doing full functional feeding assessments, so please do make sure that they are explaining to you step by step what they're looking at, what they're looking for, and why it does or does not indicate a tongue tie. If you are talking to a physician in a doctor's office, a pediatrician, at the hospital, even a midwife or an ENT, If they are not doing a full functional assessment and they're going just based off appearance, take their input with a grain of salt. That's what I'm always going to tell you. Listen to your intuition. You can always get a second opinion. Don't just take one person's word as gospel because it's probably not. I even tell my patients, like, I'm going to walk you step by step through what I'm seeing and why I think this means there's a tongue tie. If you are not comfortable with what I have explained to you, ask questions. I am happy to fully explain why I think this. Let's give it time if you're not ready. If your other provider said that there is no tie and I'm saying there's a tie, I will encourage you to get another opinion. I will give you a list of providers who I trust, but I want you to make the ultimate decision because I want you to know that you're making that choice and you're not being pushed into anything. So, as a quick recap, if you are breastfeeding and you're worried about tongue tie, just remember IBCLCs cannot legally diagnose. However, they can be critical and key to functional assessments, understanding how the tongue is working within the full context of breastfeeding for both mom and baby. Remember, pediatricians often do miss ties. This is not a diss on pediatricians at all. They are good at what they're good at, and they refer to specialists for GI issues. They refer to specialists for neurological issues. We need to make sure they are referring to specialists for feeding issues as well, and your IBCLC is that specialist. Remember, mama, trust your instincts, get the right support, and do not settle for quick answers that dismiss you when you are feeling like there's a problem persisting and your intuition is screaming. If you are ready to go deeper and learn more about tongue ties, join me inside of Latching with Confidence, my online, on-demand breastfeeding class, where you don't just get a breastfeeding class, you get support. When you join Latching with Confidence today, you're going to get free access to my Breastfeeding Your Tongue-Tied Baby guide, and you're going to get a free month of live support inside of the Confident Mama Bear Society. You can register now at littlebearlactation.com/latchingwithconfidence. If you're not quite ready for the full course, don't forget the free Secrets to a First Latch Without Pain class is coming up on April 5th, and you are invited to join us at littlebearlactation.com/secrets. I'll see you next time to talk about options for tongue tie release and how you know if you should release. All right, Mama Bear, that is a wrap for today. If this episode helped you feel a little more confident or a little more prepared for breastfeeding, can I ask you a quick favor? Go ahead and leave me a review. It helps other moms find this podcast and join us in this amazing community of fierce and confident Mama Bears. And hey, if you know a friend who could use some encouragement or real talk about pregnancy, breastfeeding, and all things motherhood, share this episode with her. You've got this, Mama Bear. Trust your instincts, stay fierce, and I'll catch you in the next episode.